first article we're going to look at today is a talk about men's loneliness crisis and some ground level type stuff to support it. People, I'm sure, well, at least I know in the UK and Australia, will have heard of men's sheds, and they're things that basically are, it's a community type thing, a self-driven community, a safe space for males to get together. Generally, it's like got a few tools and workshop type stuff, and they'll go there and just chat and do things, spend time together. Fraternal get-togethers. So I guess it's a reason why fraternal organisations through history have always had a place. So part of the issue, though, is as those sort of fraternal organisations fall out of favour, as we become more online, as the social dynamics keep changing, we find that people don't actually change all that much. They're still people. They still have the same needs, still have the same desires. And so the idea that social isolation is a problem for men's health is starting to get more awareness and more focus. And the idea that men struggle to have friendships in adulthood, it's sort of falling apart type thing. Men find themselves, especially working men, find themselves getting stuck in a rut, so to speak. They've got family, they've got a house, they've got a job, but often they're working to sustain the first two, and it's coming at a cost of self, very much so. It's not mentally healthy, and it's not physically healthy either. So, the example gentleman here during the article was rolling on 5 hours of sleep at night, going basically end to end to end to end to end, just constantly changing. And so introduced exercise first thing in the morning, probably one of the few times he had in his schedule, and started then creating a men's group around that, looking for lifestyle change and social connection. So a bit like a mobile men's shed. So they've started walking and stuff like that, and basically the men get together, go for a walk and have a chat, which is great. They connect, have friendships, decreasing isolation and loneliness as a health prevention. Beautiful sort of thing. Kiama is not a southern Sydney community. It's South Coast, South Coast community. So the fact that it became increasingly popular suggests that there was quite a big demand out there for a fraternal get-together for men, plus exercise. Team sports get harder to get into and maintain as you're getting older, all that sort of stuff. So it's just, it's finding a way to still establish that. Pub culture's decreasing. We talked about the costs of going out for things like this. So you're looking for a low cost solution. And hey, look, it's a brilliant solution. It almost seems like an exercise in stating the obvious in terms of needing research to show benefits of social programs. I would have thought that was, stating the obvious. But I guess you got to mark and measure the effectiveness. Half of the men in the study felt stress or anxiety affected their daily life. Well, from what I've seen, yeah. A third saying mental loads affecting job performance, and remoteness. Yeah, that's something that goes on through, um, well, purely because of isolation. And, well, quite clearly there's an agenda being driven by the organisation undertaking it, but that doesn't necessarily discount the message of what it discovered or that it supported them. And that you've got an outlet really for men. Now, we talked in a previous stream about the need for connection and that there were sex workers who were finding themselves almost acting in the role of therapist with their clients who were looking more for companionship than anything physical. And it seems that it's something that vanished from the male sphere, so to speak. I mean, it's one reason why, for example, a lot of military people who leave, a lot of military men who leave at an age when they can still re-enlist, there is not an insignificant proportion who return to the military, be it a couple of years later or less, because they miss the certainty, they miss the guaranteed pay and a few other bits and pieces. But a big part of why people rejoin is because they miss the community. They miss the brotherhood, so to speak, willing to put up with all the bad stuff because, well, they get a benefit out of it. So, yeah, relationship issues, mid-30s, yeah, it's an important thing. The idea that resource accessibility contributes to it. So poor access to resources, so suggesting more regional communities. Yep, communities with fewer infrastructure elements available. A lot of places, the men's sheds, it's not a government thing, it's a community thing. So it's put together by other men and giving them that space to sit down and do things. And the problem is, if you're not dealing with it, it leads to actual medical health issues, which it increases the length of time that you stay sick when you get sick. It puts added pressure on the medical system with added engagement. So it's the sort of thing, I mean, it ends rather abruptly, but it's the sort of thing that even when I was a kid, there was the initial whispers of this being a problem. I think part of the problem at the time was in particular in Australia, the Vietnam soldiers, or particularly the conscripts, the men who returned from Vietnam were excluded for a while or were looked down upon within returned services leagues, RSL clubs. It wasn't universal, but there was a lot of negativity that they received. So they missed that fraternal bond that would normally have been available to soldiers on their return. I mean, it's quite possibly just a reflection of the way society's going at the moment, and the way things change. And I've seen plenty of requests and questions on online forum groups of people moving to new cities or new states asking what they do to form adult friend groups, how they get into things. And generally the answer is sport. But there is also community groups for people that have interests and things like that. But the patronage on them is difficult. If people already feel time pressured, they struggle to insert extra time for self-care because that's ultimately what it is. So it's yeah, uh, I wouldn't say middle age, but certainly as you're getting older, um, into your 30s and 40s and stuff, yeah, you've got a lot of real world pressures, and well, there just isn't a lot of mentorship that generally is available. There isn't really necessarily the community support. You can still find those communities, but generally they have other drawbacks like isolation, physical isolation, because of being out in the regional areas, that sort of thing. Yeah, it's an interesting thing to pop up.